My name is Guy-Marc, and I'm here today to talk about my interview that I did on a patient with type 2 diabetes. So first, I will describe to you what is type 2 diabetes. According to Wikipedia, type 2 diabetes is a metabolic disorder that is characterized by high blood glucose in the context of insulin resistance and relative insulin deficiency. So in other words, type 2 diabetes is a chronic condition that affects the way your body metabolizes sugar, your body's main source of fuel. So for my interview, I decided to pick a friend of a friend who is named Michelle Reynolds. Diagnosed with type 2 diabetes 5 years ago, he still struggles with the illness, but he is getting better day after day. So basically, during the interview, we talked about different aspects of the illness and how it affects his personal life, but also how was the relationship during all the process between him and the physician that he met. So during our interview, three themes actually came to light and were related to our course. Those were how the diagnosis, treatment, but also challenges affected his life, but also his communication and relationship with the physician that were basically taking care of him. I could actually observe three aspects in the diagnosis of his illness. Discovery of the condition. The way he discovered his condition was because he was at work, actually fainted, was rushed to the hospital in emergency, and after they ran some tests on him, discovered that he actually had type 2 diabetes. Reason of the condition. As far as his eating habits, Michel knew that they were not right. He has been juggling between jobs in order to pay his college courses since he is 16 years old. Was in college and was still working and didn't have time to actually have a decent diet, but also time to exercise. He started to put on weight, but didn't think it was a bigger deal than that. He always felt like he was fine and actually never really heard about type 2 diabetes. Accepting the condition. At first, it was a little bit hard for him to admit the condition to himself. He had a hard time to accept. Even though it was curable, the simple fact of having it was bothering him. On top of that, he was so ashamed of the condition that it took him a good month before he opened up to his family and told them about it. His weight was already a problem to him, so he felt like it's because it was just irresponsible. It was his fault. Patient and caregiver relationship during the diagnosis process. In the diagnosis process of his illness, we can actually relate several aspects of it to our course. The physician that was taking care of him that day was not very concerned by his condition. He asked him a couple of questions about his personal life and made the remark to him that it was the only thing that could happen because of his way of living. The physician also started to use a lot of technical words in order to describe what he had, and when Michel, the patient, tried to actually apologize about his condition and that it happened because he has to work a lot, the physician could have cared less. He just shook his head, walked away, and told him that he would have to go see his general physician in order to start his treatment. The nurse that was coming in and out of the room was actually more pleasant and understood where he came from. She talked to him for a little bit and told him that everything would be alright. Another point that was that Michel actually told me he actually waited long hours that day at the ER because of how crowded was the place and that there was not enough doctors for the number of patients, which is, I guess, a normal day over there. So basically, during the diagnosis of his condition, we can observe that Michel has been confronted to a power difference from the physician, but also a patronizing behavior. He was quite embarrassed by his condition and his physical condition too. Because for him, when you talk about diabetes, he instantly thought about being overweight and even say a thing to the physician because he felt like he was wrong in the first place and had no idea of what was type 2 diabetes. He also witnessed the effect of blocking. He didn't receive any compassion from the doctor when he tried to talk about the different problems in his life, and that the physician just kept asking him questions instead of actually paying attention to him. On the other hand, the nurse was more sensitive and understood where he came from. The other aspect that we came into was his treatment. So we find two aspects in it. Requirement for treatment. Basically, for his treatment, his general physician told him that he could separate it in four classes. First, he had to change his way of eating. He had to focus pretty much on eating low-fat food with high fibers, like fruit, vegetables, and whole grain. He went to a dietitian to put together a meal plan. The second part was to monitor his blood sugar. He had to do it at least 3 times a week. The third part was to actually have physical activity for at least 30 minutes a day. The fourth one was the medication that he had to take, which was just insulin. The reality of the treatment. From what he told me, he had a very hard time to actually follow all that was required. Because he is a busy person, sometimes he didn't have time for it, especially when he just got diagnosed. He didn't pay too much attention to the treatment, but was reminded by his physician the importance of it. And throughout the years, he actually started to make time for it and be more conscious about it. So the patient and caregiver relationship during the treatment process. Because he was so bothered by his condition, he started to go online and look for information about it. So when he went to see his physician for the first time, he pretty much knew what they would talk about. The physician was actually a good listener and took his time to understand and listen to Michel's problem. And because he had a good idea about what was going on, the communication was even easier. So Michel was actually in presence of collaborative communication, assertive behavior, and biopsychosocial model. On both sides, they communicated and actually came up with an agreement on how to treat him even though he was very busy. Every time he would come for a checkup, the physician was always there for him to listen and understood what he was going through. Maybe because it was due to a young age, he said. The third part, which is the challenges, are from two aspects. So the lifestyle. So one of the main problems he said he encountered was to actually adapt his illness to his way of life. He understood after a long time that it has to be the other way around. Adapt his way of life to his illness. A lot of changes had to be made in order for him to treat himself. He decided to live at home to make it easier, and his family was very involved in trying to help him to cure himself. He knew that it would not be easy, but he had to do it to save his life. Emergencies. The doctor told him that during sick days, if sometimes he was getting sick, that he had to be very careful because the illness could actually make it worse, and a simple cold or just something basic could actually go to another level. So he had to be very careful with that. And of course, his eating habit was changing, so he had to actually make a major change on the way he was eating. So the patient and caregiver relationship during the challenges process. So the reason I actually talk about challenges is because at one point in his life he was feeling very depressed and also stressed because of the illness, among other things. He actually decided to see a psychologist in order to help him. Of course, the psychologist was a very good listener, but it is just to show the impact that the illness has on him. It is not only physical but also psychological. He also experienced the biopsychosocial model with his psychologist. Even though sometimes he wasn't agreeing with everything his psychologist was saying, he sometimes never said a thing because he didn't know what would be his reaction and was pretty much sometimes just listening to him. He didn't go into details because he was too personal. He actually also experienced a patronizing behavior, but admitted that all the sessions will help him. So in conclusion, this patient was actually in presence of different aspects of healthcare communication. Having knowledge of them make you understand that health is something very important, but that communication is even more important because it is what helps the two parties, patient and doctor, to understand each other and come up with an agreement on how to be treated, but also allow both parties to develop a relationship. The other aspect that we can observe from the interview is that the patient actually faced different types of physicians with different ways of being treated, as far as physically or emotionally. So this simple interview showed that the healthcare system is definitely not perfect and that it needs to improve in order to have a better relationship between patient and physician. Thank you.